Welcome back to another episode of the BioHub. Today, we're thrilled to be joined by Ravneesh Sachdev. Ravneesh currently serves as partner and head of business development at Appletree Partners, a leading life science venture capital firm with 2.65 billion in committed capital. Ravneesh's 25-year career has spanned across big pharma, biotech, and now on the venture side, and has played a key role in several high-profile M&A and licensing transactions. So Ravneesh, it's an absolute pleasure to have you on today.
Likewise. Thanks for having me, Tom.
Yeah, cool. Well, to jump straight in then. So I guess, can you provide a bit of an overview of your career journey so far and how you got started in the biotech field?
Yeah, definitely. So starting all the way back to when I was a college student, I was already in life sciences because I was training to be a physician first. And then eventually I didn't like what I was doing in the terms of the class I was taking. So I decided to switch over to going to get a PhD instead. And so I was doing a bit of research in undergrad to sort of learn the ropes and figure out, how the best way to get into research was going to be. And I even did my senior thesis at a biotech company, sort of to learn not just how to do research in industry, but in academia, but also in industry. So these are all my first exposures into life sciences. And then when I finished undergrad, I did go work for a bit because I wanted to get some work experience before going into academia full-time, getting my PhD. And I realized when I went full-time into academia, I missed all the industry side of the work that I was doing when I was doing my senior thesis in undergrad. And so I realized that actually, industry seems more interesting to me now than going back into academia, going into med school, which was my original plan. And so I decided to enroll in graduate school that was specifically catered to people like me that started their careers more on the academic lab side, maybe wanted to be a physician at one point to fully transition into industry, but cutting across the entire sector. So it can be in therapeutics, med tech, and across all functions as well. The education was intended to be broad. And this was the Keck Graduate Institute of Applied Life Sciences in California. And still first of its kind, still the only of its kind that does this. So I'm proud to be a board member there as well, to continue to work with them to educate the next generation of leaders for this. But since I've graduated from there, I've been in industry. So I did my summer internship between my first and second year at Daiichi Pharmaceuticals. So this was this obviously now a much bigger company, but back then Daiichi had not merged with Sankyo yet. Sankyo was in the process of buying Daiichi. I was working at a much smaller company. They were very new to the US. I was one of the first few US employees. And but of course, after Sankyo acquired us, it became a much larger company. And the role that I was in also changed quite a bit, and which was, by the way, I should mention, it was in business analytics. So a lot of the training that I got from the school, the internship led into a full-time job in that space. And analytics for me was great because I got to learn how to do forecasting, market research, competitive intelligence work for all the inline programs. But after the Sankyo acquisition happened, a lot of things had changed. So I decided that I was ready to move on to a different company. And Pfizer at the time was looking to hire for someone like me, business analytics work. But the interesting thing was at Pfizer, the difference was that it was the work was related to more business development opportunities, so not about inline products. So that was my first exposure to business development. And so when I joined Pfizer, it was in the business analytics team for 6 months or so. And then eventually there was an opening in the business development team. So I joined them full time and learned how to evaluate deal opportunities. So this really was the true, I would say, transition into business development as a career for me. And this is now over 20 years ago. So with Pfizer, as with most pharma companies, and even still today, business development is subdivided into 3 functions usually. There's the search and evaluation function, there's the transaction function, and then there's the alliance management function. So if you are in pharma, you generally fall in one of these 3. And for me, it was great in the beginning because I was on the search and evaluation side. So I was helping out with analytics, as that was what I was hired to do. And then, doing technical diligence as well, leading some of it, and, really learning the ropes about how to run a good process when it comes to business development. So I really enjoyed that. But I realized also over time that I wanted to learn the other side of it. I wanted to learn transactions. I wanted to learn alliance management. And that's where the limits for myself anyway, being in pharma, became apparent. And so that from that point onwards, I started to look at if I could find an opportunity where I could do all 3 of the functions that I mentioned. And I realized pretty quickly that it doesn't exist in pharma because, as I mentioned earlier, they tend to fall in one of these three buckets. So then I started to look at smaller and smaller companies that may find that they don't have the resources to be able to hire for each individual function. If you're going to be a BD person, you're going to have to own the deal from beginning to end. And so when I started focusing my search on that, I realized that, yeah, it had to be a smaller company. And that's what happened. I joined a commercial stage biotech company called Onyx Pharmaceuticals. And so they didn't have any research. Business development was going to be their pipeline development efforts. And I realized pretty quickly during the interview process that this is exactly what I'm looking for, because I get to lead my own deals from beginning to end. And so when I joined Onyx, that's exactly what happened. We did a number of deals over my 5-year career there. I also got to help open their first international office as their head of international business development. That was for my last couple of years at Onyx, and this was in Switzerland. So then we got acquired by Amgen. And so when that happened, then I really didn't want to join pharma again for all the reasons that I left Pfizer. So I decided to leave Amgen to join a European company, biotech company called UCB Pharma. So I moved from Switzerland to the UK. And so I was working out of London for a couple of years. I led their business development efforts for a new business unit for bone disease. And so that was a lot of fun. That was my first leadership role over global business development efforts. And so I enjoyed that. I did a few deals before eventually repatriating to the US. And I joined a biotech company in New York called Acorda Therapeutics, also very similar setup as with UCB and Onyx, looking to build business development, led a bunch of deals there. And then unfortunately, they went through some pretty hard times as a company. So they had a number of reductions in force. I was one of the ones affected, but was fortuitous for me because I moved from New York to Boston, and this was 7 years ago. And Boston being the hotbed of the bioscience ecosystem, probably the only ecosystem that I hadn't lived in yet. And so I was really excited to be in the Boston area. And so I joined a company called Bioveritav, which was a newly spun out company of Biogen, a commercial stage company. Anything that was not CNS spun out into this company. They were looking to hire quite aggressively. So I joined them as a VP of business development. Enjoyed it, but then 10 months later, we got acquired by Sanofi. I still got to do a bunch of deals, though, between that. And I did stay with Sanofi for a year. I didn't expect to, but I did stay because I wanted to finish the deals that I'd started. And so when I was finished with that, I went back to what I loved, which is smaller company. So I joined Sage Therapeutics, and this company was also looking to build business development. I was there. I got a chance now to lead business development as an entire function. So for the whole company. So that was a lot of fun, and ended up culminating in the $3.2 billion deal that we did with Biogen. And we did this in the middle of right around the pandemic time. So that also, from a timing perspective, it worked out quite well for the company because, as you know, during the pandemic, a lot of companies unfortunately didn't fare well. Downturns and rifts, and it was hard to access capital. So that deal ended up saving the company for quite a long time. And they're still really benefiting from that deal. So I'm glad that I got a chance to do it. But I knew that I was working myself out of a job because they were not going to do anything more after that deal. So I left right after that deal was signed, and I joined a company called Acceleron Pharma. And so it's very similar, looking to build business development. They had a small pipeline, needed more, and did a couple of deals there. But then eventually I led the sale to Merck. And so that ended up being, the culmination of my time there, even though it was shorter than I expected. And since then, I've been at AppleTree Partners as a partner here. And so before I joined them, I was actually very close to becoming a CBO of another company, a commercial stage company. But ATP made a very enticing offer for me to try out venture. And since then, I've been here now almost 3 years, and I've really enjoyed it because I get to do business development here on top of the venture role, because the way we're set up here at ATP is that we all have operating roles, and because we all come from operating backgrounds. And so I get to be the business development guy here within our firm across all my companies. So everything I've ever done, just multiple fold. So that's a very short, I hope a short and cogent summary of my career since I started in business development all the way to now.
Yeah. I speak to a lot of people probably daily that want to make that transition, I guess, from industry onto the venture side. How have you found that transition?
Yeah, it's been great. And I think, part of the reason, I think I've really found myself enjoying this role is because we have this venture creation model. So we're not like typical venture capital firms where we have investors that are investing in all kinds of different companies. We're listening to pitches and things like that. We are more proactive in the investment side of things because we're building our companies. We're going to academia, we're sourcing technologies from different labs. We have incubators that we've set up as well so that scientists can come and talk to us about interesting work that they're working on. And so because of this hands-on, grounds-up approach that we have, this very operator-heavy approach that we have, I've gotten a chance to really use the skills that I've developed over my last 20 years in business development from day one. So I didn't have to really transition too much into a brand new something. So if I joined maybe a venture capital firm, and of course, without knowing the details about how it all works internally, because I've never been there, it would probably have been a bit harder for me because I've never been an investor. And even though I'm sure, when I'm reviewing opportunities, it's not that dissimilar from being in business development where I'm evaluating something that I want to license in or to acquire. I would imagine that's still a bit different because you're listening for different things. You're creating value in different ways. So it probably would have been not as smooth of a transition as I am in the role now, where I still get to do what I'm doing just across multiple companies.
So I guess collaboration is really key important in biotech. How do you maintain relationships with external partners and I guess other stakeholders to drive that innovation and growth?
Yeah, absolutely. So yes, you're right. We have to maintain relationships at all times. So the good news is that because I've had such a long career in business development, I've known folks in the pharma space for a long time, particularly in business development. So when I moved over to ATP, it was really about reestablishing those connections and letting them know, first of all, that, hey, I'm in this new role. And I'm representing a number of companies, and I'd like to reconnect with you and let's talk about my portfolio and see if there's a chance for us to work together on something. If not in the near term, then certainly, even if it's a year or 2 years from now. But that's the start. And then as our company progresses in their data generation, in the platform development as a whole, always proactively keeping those companies up to speed. Meaning pharma companies up to speed about what's happening. We do this on a frequent basis, and this is usually even in between the usual touch points at conferences like Bio or JP Morgan, where we're touching base. And not only are we providing updates on our portfolio, we're also soliciting updates on their strategic priorities, which also will change from time to time, and making sure that we're aligned in the things that we might be interested in working on together. So this kind of proactivity, this kind of frequency and depth of relationship that I've established and then will continue to maintain, that's going to be essentially the reasons why when the time does come for us to work on something together, it'll be an easy transition to getting it done.
With that, the biotech industry is super competitive as well. How do you differentiate your company in the marketplace and I guess position it as an attractive partner for collaborations and licensing agreements?
Yeah, so I mentioned already that our firm is quite different from most venture firms. So in that way, because we are very hands-on in our companies, there's a sense of comfort, I think, from the pharma company side, knowing that we're so hands-on and that we're very, very well versed with the science in all of our companies. That also, as I mentioned, it gives them comfort that we know what we're talking about and we're developing something that truly is going to be meaningful and groundbreaking. Of course, many companies do fail, so that's just the nature of being in our ecosystem in biotech in general. So but to the extent that we know as much as we do and we share as much as we know how to share, we will do that. And in many cases, we'll collaborate with them as well about how to mitigate for some of these failures that are inevitable as well. And collecting feedback from pharma companies, to make sure that we are heading in the right direction is part of the discussions we normally have with them. So that's on the firm side. Now, on the company side, we do not that dissimilar things as well as with other biotech companies. We try to really position ourselves in terms of differentiation. That's also even part of our company creation thesis as well. It needs to be in the thesis before we even put money into our companies, that how is this really going to move the needle? How is this going to change the ecosystem in a positive way? How, what kinds of data do we need to generate, the killer experiments we need to do to make sure that what we've hypothesized before we did it is going to actually bear out. And if it doesn't, then we have to pivot and do something else, or we don't move the companies forward. So by the time we're starting to talk to collaborators on this, we've already passed a lot of those hurdles by showing the differentiation. And then now is the time to convince the collaborators, the pharma companies, that what we've seen internally, we hope we can convince you so that you can collaborate with us going forward.
Yeah. And I guess the biotech market is obviously tough this year. Appletree have I guess, done a few deals and investments that I guess have really stood out this year. Can you share, I guess, some of the shared developments, expansions, or I guess some of the milestones achieved within some of the portfolios?
Yeah, definitely. So we've had, in our current fund, we raised, this is Fund 5 for us. We closed it in December of 2020. So it's been now almost 4 years since we've had this vintage online. And since then, we've, with this fund, we've had now almost 15 companies in our portfolio from that fund. And they're at various stages of development. The ones that we've progressed, this year particularly, and last couple of years, have been where we have generated clinical data, and many of it very, very positive. We've also developed development candidates as well. We've declared them, and these are the programs that are going to be our lead going into the clinic. So that'll happen within the next 12 to 18 months. So these are some of the progress we've made on the development side of things. And then on the collaboration side, we have as well. We've signed a number of deals since I've joined. One of our companies, Acorda Therapeutics, has signed 2 deals with Ipsen Pharma since I've joined. So they're big fans of our technology, which is great. One of our other companies just signed a deal this summer. It's called a company called Sage Therapeutics. They signed a very large deal with Roche as well for a number of preclinical programs. So our lead still belongs to us. We also have done a clinical trial collaboration. So no rights exchange, but data generation type of a collaboration between one of our companies, Aulus Biosciences, and German Merck, to combine Aulus's program with German Merck's PD-L1 program to show hopefully synergies between 2 very exciting molecules. So that's another example. We've also done a discovery stage collaboration with one of our newer companies, Acorda Therapeutics, working with another biotech called Revolution Medicines as well, to combine our platforms to work on some pretty interesting therapeutics. So, and all of this was done this year, hopefully more to come, second half of this year into next year as well. And I'm excited, looking forward to it.
Yeah, absolutely. And I guess, so your role, it sounds like Appletree is super busy right now. Just to break down your current role, your main responsibilities, and I guess how your responsibilities contribute to the success and growth of the company.
Yeah, so my role has been, and always be since I've started, is to help our companies figure out ways to inorganically grow. So this is beyond the science that they're working on, which are all very exciting, all the programs that they want to prosecute, bring into the clinic and beyond, et cetera. How do we, then, and obviously all of this is in the backdrop of figuring out how do we fund this, right? So ATP, obviously, we're committed to our companies. We've given them the funding that they need, but we're also not going to be the only investors in them forever. And so how do they continue to operate as a going concern, beyond what we've already invested them from a financing perspective? So this is where my role comes into play. So I'm there helping my companies figure out, who do we want to collaborate with? What do we need from our collaborators, both from a financing perspective as well as from a resources and people perspective? And I also do this on the investor side as well. So who are the Series B investors out there that might want to syndicate with us now that they've seen certain pieces of data that are interesting to them? So that's on the investor side. And then there's also, exits. So if there are pharma companies that are interested in acquiring one of our companies, how do I make sure that our companies are prepared, on how to run a good process to get acquired? Or if there's a way for us to go public, in this market, maybe not so much, but hopefully, when the market does recover, knock on wood, within the next several months, there's an exit scenario where we can contemplate where we can go public, and working with the various bankers and other types of advisors that can help us, move along our companies to the point that we can take them public, and get liquidity for us as a fund. So all of this is within my purview as a business development professional.
Yeah. And I guess just moving on to the market itself, I guess what are the current trends right now that you're sort of finding most intriguing, and how they could potentially shape the future of the field? I know a lot of hot topics right now. There's obviously AI. I know ADCs are hot right now. What trends are you seeing right now?
Yeah, the thing about trends is that they come and go, right? So at this point, there's, cardiometabolic disease is obviously very big. A lot of different players are in it. If you don't have AI somewhere within your discovery engine, you're probably going to be behind. But I'd caveat that by saying about AI that you still have to be a drug development company and not an AI company in of itself. The AI in of itself should be enabling, and that's it. We're not building tech companies. We're still a drug development ecosystem. So the AI should make your companies more efficient. You create better molecules. You in effect increase the probability of success for your molecules, so that they do make it to market and they do make a difference. So that should be part, again, of how you evaluate AI types of systems. I mentioned cardiometabolic. Oncology is always it's still number one, and it will be number one. There's talk about, there's less investment. No, there isn't. Oncology is still number one by far. There's different flavors of oncology. Yes, like you mentioned, ADCs. It's a hot space right now. Radiotherapeutics is another hot space as well. Maybe less what IO was for a while, but maybe not as much anymore. Small molecules, I still think, are a good space to be in, particularly in synthetic lethality. Because the programs that AZ and others are marketing are doing quite well, and that space and area is going to continue to do well, at least for now. So oncology will always be there. Immunology is big, but immunology has always been big. Humira was the biggest drug in the world for a very long time, so it will continue to be that way. I'm gratified that CNS is having a little bit of a renaissance. We've gotten some good M&A that's happened in the space, some good development as well. New mechanisms, new areas of biology to unlock. Still a very tough space. But little bit by little bit, we're unlocking the secrets of the brain. So I'm very happy that that's also something that's happening. So these are some of the sort of the trends that are happening, I think, in the biology and chemistry ecosystems.